You need a leader like Stu that looked at Hofstra and said, yeah, this is a good university. It can be a great university.
The first thing that pops to mind is the Zucker School of Medicine, which is really a leader.
A lot of schools are starting to transform their curriculum to what we have, but in our first year, we make it a point to be patient-centered from day one.
Nurses are the heart and soul of healthcare and are vitally important to the health of the nation.
I remember having breakfast at Stu at the Garden City Hotel. It was a very important breakfast because we were doing a lot of work together prior.
And it's still in dispute who paid for that breakfast. But what's not in dispute is what started out as a meeting to figure out a few more ways the two institutions, Hofstra and the health system, could cooperate, ended with an agreement that we really needed to partner and start a new medical school.
There was not a replica of the old, but something different and new. So quite frankly, it was transformative. And transformative for the future of medical education, transformative for Long Island, and transformative for both Northwell and Hofstra.
It completes the picture. In addition to all the strength we have, it gives us a medical school and builds up all of our hard science programs, and that makes us a complete university.
And I think it's turned out to be one of the best moves in Hofstra's history.
And I think medical schools pull the institutions forward.
Hofstra, which I think always had a great reputation, really now enjoys a national, if not an international reputation for excellence.
Dr. Brittany Elizabeth Nathan.
The Pipeline program is a 3-year summer program for sophomores or rising juniors up until rising freshmen in college. The biggest thing I gained was, of course, mentorship. A lot of my professors here actually knew me since I was 16 years old. So it was nice to be able to see doctors who look like me and expose me to the fact that this is something that can be accessible to me. I just needed the right resources to get there.
If you look at, there's a long list of other innovations at Hofstra that Stu, since the time he became president, began to move. He created a school of engineering, and of course the medical and the nurses school on top of that.
First there was the graduate nursing program, now the undergraduate nursing program, taking the engineering program and actually doing a whole school of engineering. Always looking to innovate, always looking to see where the needs are.
The healthcare delivery system is going under a major transformation. We have technology advances that are really redesigning the delivery models of how we deliver healthcare to improve access to care. So we believe at this point in time, we will be able to help address all those challenges that are occurring now and in the future with the new pipeline of registered nurses.
I am so pleased that my final groundbreaking is this one, because it breaks ground on Hofstra's newest classroom building, its state-of-the-art laboratory building, the Science and Innovation Center. And this will be a 75,000 square foot structure on our campus, which I feel appropriately signifies 20 years of spectacular growth at Hofstra in sciences, medicine, and healthcare.
We knew that when we would start something like this, that it would have other innovations that would sprout from. And look what has happened. We have new relations with the law school, new relations with the engineering school. Now we have the nursing school, we have the PA school, which has been incorporated with the nursing school. Now we're starting an undergraduate nursing school, doctoral nursing program, and lots of other things are going to emanate from this.
It was a dream of mine in order to round out Hofstra University into a nationally prominent university.